If you're over 60 and you've been told to drink apple cider vinegar before meals to lower your blood sugar, stop just for a moment. Because what your friend told you, what the Facebook article said, and what the wellness influencer posted are all based on the same four small studies. And those studies, when you actually read them, say something very different from what's being sold. Apple cider vinegar can lower blood sugar. That part is true. But there are three medications it interacts with dangerously, two senior-specific risks nobody mentions, and one specific time of day to take it that makes the difference between a real effect and wasting your money. Or worse, ending up in the emergency room. I went looking for every human study on apple cider vinegar and blood sugar in adults over 50. I found 19 of them, and what I found will probably change how and whether you keep using it. Stay with me.
Before we open the first study, you need to understand why apple cider vinegar is a different conversation for seniors than it is for anyone else. Blood sugar regulation changes after 60. Your pancreas produces insulin a little slower. Your muscles absorb glucose less efficiently. If you have type 2 diabetes, and roughly 1 in 3 adults over 65 do, though many don't know it, you're probably on at least one medication that's already pushing your blood sugar down. Adding something else that pushes it down further isn't always helpful. Sometimes it's dangerous. And there's a second factor specific to seniors. Apple cider vinegar is acidic, strongly acidic. The senior digestive system, the senior esophagus, and senior tooth enamel all handle acid differently than they did at 40. The same dose that's harmless for a 35-year-old can cause real damage in a 70-year-old over time. So the question isn't, does apple cider vinegar lower blood sugar? That question has been answered. The real questions are, how much does it actually lower it? In whom, with what side effects, and at what cost to other parts of senior health? Here's what we're covering in the next 60 minutes. First, the 4 landmark studies that started the modern conversation and why their results are smaller than you've been led to believe. Then the meta-analyses, the studies of studies, that pulled all the evidence together. We'll spend real time on the mechanism because understanding why it works tells you when it won't. Then we'll get specific on dose, timing, form, and the brand decisions that actually matter. We'll cover the senior-specific risks that the wellness internet completely ignores. We'll go through the medications it interacts with. And we'll close with exactly what I'd tell my own grandmother if she asked me about the bottle on her counter tomorrow. Grab a notepad. There are specific numbers in this video you'll want to write down. Let's start with the study that built the entire wellness industry around this topic. The original study, the one every blog post, every TikTok, every wellness book traces back to, was published in Diabetes Care in 2004. The lead researcher was Dr. Carol Johnston at Arizona State University. She has spent more than 2 decades studying vinegar and metabolism, and her work is genuinely respected in the academic nutrition community. Here's what the 2004 study actually did. 29 people. 3 groups: healthy adults, adults with insulin resistance, and adults with type 2 diabetes. They all ate the same standardized breakfast: a bagel with butter and orange juice. Some drank a small amount of apple cider vinegar diluted in water before the meal. Others drank a placebo. The result in the people with insulin resistance, vinegar reduced the post-meal blood glucose spike by approximately 34%. 34%. That's the number the entire wellness industry has been quoting for 21 years. But, and this is where the wellness internet stops reading, that 34% reduction was in a tiny 3-group study with no long-term follow-up, measuring a single meal in a single morning. It was a proof of concept, not a clinical recommendation. Dr. Johnston herself said as much in subsequent interviews. Study 2, also Dr. Johnston, published in 2007. This one was longer, 12 weeks. 11 adults with type 2 diabetes. 2 tablespoons of apple cider vinegar at bedtime versus water as control. The result, fasting morning blood glucose dropped by 4 to 6%. A real reduction, statistically significant, sustained over 12 weeks. Pause on that number, 4 to 6%. If your fasting blood sugar runs 140 milliliter DL, which is mildly elevated, a 5% reduction takes you to 133 milliliter DL. That's a real change, but it's not transformative. It's not, you don't need your diabetes medication change. It's a small, supportive change that exists alongside everything else you're doing. This is the gap between what the studies actually show and what the marketing claims. The studies show modest, supportive effects. The marketing claims miracle reversals. Those are not the same thing. Study 3 takes us to 2010. A Greek research team, this time studying 16 healthy adults, but with a different methodology that gave us important new information. They tested vinegar at 3 different doses, 10 milliliters, 20 milliliters, and 30 milliliters, taken before a high-carbohydrate meal. What they found was a dose-response curve, but not in the direction you might expect. Higher doses didn't produce dramatically larger glucose reductions. The effect plateaued. 20 milliliters, about 1.3 tablespoons, produced essentially the same effect as 30 milliliters. Going higher just gave you more acid exposure without more benefit. This is critical. If you've been taking 3 or 4 tablespoons a day thinking more is better, the research says you're getting acid burden without additional metabolic effect. Study 4, 2017. Iranian researchers, 27 adults with type 2 diabetes, 8 weeks. 2 tablespoons of apple cider vinegar daily versus control. They measured not just blood glucose, but also HbA1c, the 3-month average measure of blood sugar that doctors actually care about. The result, HbA1c dropped from 7.6% to 7.2%, a 0.4-point reduction. Now, context. A 0.4-point HbA1c reduction is real. It's not nothing. For comparison, metformin typically produces a 1.0 to 1.5-point reduction. So apple cider vinegar produced roughly a quarter to a third of the effect of a basic diabetes medication. That's a useful framing, not a miracle, not a placebo. Roughly 25 to 30% of what your prescription is doing. Apple cider vinegar is doing something. The something is small to moderate. And the question of whether to use it isn't about whether it works, it's whether the benefit is worth the cost in your specific situation. Let me give you the synthesis of these first 4 studies. In healthy adults and adults with type 2 diabetes, taking 1 to 2 tablespoons of apple cider vinegar before or alongside meals modestly reduces post-meal blood glucose spikes and produces small reductions in fasting glucose and HbA1c over weeks to months. The effect is real, replicable, and far smaller than the wellness industry claims. But 4 studies is a small evidence base. To know whether this finding actually holds, you need to look at the meta-analyses, the studies that pool all available evidence and check for patterns. And there have been 3 major ones. We'll cover them next. A meta-analysis is what scientists use to figure out whether a finding from individual studies actually holds up across the whole body of evidence. Individual studies can be flukes. Meta-analyses smooth out the flukes and reveal the real pattern. The first major meta-analysis on vinegar and blood glucose was published in Diabetes Research and Clinical Practice in 2017. It pooled data from 11 randomized controlled trials covering hundreds of participants. The conclusion: vinegar consumption produced statistically significant reductions in fasting blood glucose and HbA1c in people with type 2 diabetes. The effect size for fasting glucose reduction averaged about 8 ml/dl. For HbA1c, the average reduction was roughly 0.3 to 0.5 percentage points. This confirmed what the individual studies suggested. Real effect, modest size. The second meta-analysis came in 2021, published in BMJ Nutrition, Prevention, and Health. Larger pool, 14 trials, more rigorous methodology. Same conclusion, small but statistically significant reductions in fasting glucose, HbA1c, and post-meal glucose spikes. But this meta-analysis added something the first one didn't. It noted that the effect was strongest in people with already elevated blood sugar, pre-diabetics and those with type 2 diabetes, and weaker, sometimes statistically negligible, in people with normal blood sugar. This matters. It means if your blood sugar is already well controlled, apple cider vinegar isn't going to lower it further in a meaningful way. The body has homeostasis. It defends normal ranges, which raises an important question. If you're taking apple cider vinegar as a preventive to keep your already normal blood sugar normal, the research doesn't support that use. The benefit, such as it is, exists primarily in people whose blood sugar is already elevated. The third meta-analysis was published in 2024 in the Journal of the American College of Nutrition. This one was the most rigorous yet. 16 trials, with subgroup analyses by age, by baseline glucose, by dose, by duration. The key finding for our audience: in adults over 50 with type 2 diabetes, the average reduction in fasting glucose was approximately 11 mg/dl, and the average HbA1c reduction was approximately 0.4 percentage points when consumed at 15 to 30 milliliters daily for at least 8 weeks, 11 milligrams per deciliter. 0.4 HbA1c points. Those are the numbers backed by the strongest available evidence in our specific demographic. Now, and this is where independent analysis becomes important. The 2024 meta-analysis also flagged something the wellness internet ignores. It found that the published studies showed evidence of mild publication bias. That means smaller, less rigorous studies that found dramatic effects got published more easily than studies that found nothing. When the authors statistically corrected for publication bias, the effect sizes shrank slightly further. This is normal in nutrition science. It doesn't mean the effect is fake. It means the true effect is probably at the lower end of what's been reported. So here's the honest scientific consensus, summarized in one sentence. In adults over 50 with elevated blood sugar, consuming 1 to 2 tablespoons of apple cider vinegar daily for at least 8 weeks produces a small, real, statistically detectable reduction in fasting glucose and HbA1c that is roughly 1/4 to 1/3 the size of standard diabetes medication effects. That's the actual evidence. Not bigger, not smaller. That. Everything else you've read or watched on this topic should be evaluated against that baseline. Let me pause for 30 seconds before we get into the mechanism, which is where it gets practically useful. If this kind of evidence review is what you've been looking for, actual studies, actual numbers, no hype, no fear, the subscribe button below this video is how the next ones reach you. I'm publishing magnesium for sleep next week, garlic for blood pressure the week after. Same approach. Every study, every dose, every interaction, and a clear bottom line you can take to your doctor. There's a free PDF in the description with citations for every study mentioned in this video. Print it, take it to your next appointment, hand it to your physician. That's how this channel is meant to be used. Now, let's talk about why apple cider vinegar lowers blood sugar. Because once you understand the mechanism, the right dose, the right timing, and the right person to use it become obvious. Apple cider vinegar is roughly 95% water and 5% acetic acid. It's the acetic acid that does the work. Everything else, the mother, the cloudiness, the antioxidants, has either no proven blood sugar effect or effects so small they don't register in clinical studies. This is the first myth to dispense with. The mother, that stringy sediment in unfiltered vinegar, has been heavily marketed as the active ingredient. It isn't. The mother contains beneficial bacteria and trace compounds, but the blood sugar studies were done with both filtered and unfiltered vinegar, and the effect was the same. Pay extra for with the mother if you want to. Just know you're paying for marketing, not measurable metabolic benefit. So how does acetic acid actually lower blood sugar? 3 mechanisms have research behind them. Mechanism 1, delayed gastric emptying. Acetic acid slows the rate at which food leaves your stomach and enters your small intestine. This means glucose from the meal enters your bloodstream more gradually, producing a smaller, broader peak instead of a sharp spike. A 2007 study in BMC gastroenterology showed gastric emptying time increased by approximately 30 minutes after vinegar consumption. This mechanism is the most robust and the most relevant for post-meal glucose control. It's also why timing matters so much. Taking vinegar an hour after a meal does almost nothing because the food has already left your stomach. Mechanism 2, improved insulin sensitivity in muscle tissue. Acetic acid appears to enhance how efficiently your skeletal muscles take glucose out of the bloodstream. The exact molecular pathway involves activation of an enzyme called AMP activated protein kinase, AMPK, which is the same enzyme metformin partially activates. So in a sense, acetic acid is producing a very mild version of one of metformin's mechanisms. Mechanism 3, reduced liver glucose output, primarily during the overnight fasting window. This is the mechanism that explains why bedtime vinegar consumption reduces morning fasting glucose. Your liver produces glucose all night to keep your brain fed. Acetic acid appears to modestly suppress that production. Now, here's the practical implication of understanding the mechanism. The bedtime dose targets mechanism 3. The pre-meal dose targets mechanism 1. They're not the same intervention. They produce different effects on different glucose readings. If your problem is high morning fasting glucose, bedtime is the right time. If your problem is post-meal spikes, 10 to 15 minutes before the meal is the right time. Taking it randomly throughout the day is throwing benefit away. Here's the second practical implication, and this one might surprise you. The mechanism depends on the meal containing carbohydrates. If you eat a meal that's primarily fat and protein, eggs and bacon, for example, pre-meal vinegar has almost no effect because there's no carbohydrate spike to blunt. Save it for the carbohydrate-heavy meals: rice, bread, pasta, potatoes, fruit-heavy breakfasts. This is the hidden insight that wellness content never explains. Apple cider vinegar isn't a general blood sugar medicine. It's a specific intervention that works through specific mechanisms in specific contexts. When you align it correctly, right person, right time, right meal, you get the modest benefit the studies show. When you misalign it, you're just drinking acid for no metabolic reason. Now we get specific. The studied effective dose across nearly every well-designed trial is 15 to 30 milliliters daily. That's 1 to 2 tablespoons. Dilute it in 8 ounces of water. Always. Drinking apple cider vinegar straight is bad for your teeth, your esophagus, and at higher doses, your throat tissue. There is no senior health context where straight vinegar is appropriate. Dilute it. Dosing pattern that the research supports. Split into 1 or 2 doses daily. Either 1 tablespoon before your largest carbohydrate meal or 2 tablespoons total split between bedtime and pre-meal. Going above 2 tablespoons daily produces no additional benefit and significantly increases acid exposure. Now let's talk about the form, because this is where the supplement industry gets predatory. Form 1, liquid apple cider vinegar. The studied form, the cheapest, the most acid exposure to teeth and esophagus. Form 2, apple cider vinegar gummies, marketed as a gentler alternative. Here's the problem. Most gummies contain a fraction of the studied dose. A typical gummy contains 500 milliliters of vinegar powder. 2 gummies, the standard daily serving, provide roughly the equivalent of 1 to 2 milliliters of liquid vinegar. The studied effective dose is 15 to 30 milliliters. You'd need to take 30 to 60 gummies a day to approximate the dose used in the studies, at which point you're consuming significant amounts of sugar from the gummy base. Apple cider vinegar gummies, in nearly every brand currently on the market, are not delivering a clinically effective dose. They're delivering a marketing effective dose. If a brand is selling you blood sugar benefits from gummies and the serving size is 1 to 2 gummies, the math doesn't work. Form 3, apple cider vinegar capsules. These can deliver higher doses without the dental erosion. The best of them contain 500 to 1,500 milligrams of concentrated vinegar powder per capsule. The challenge is that capsule formulations bypass the oral and esophageal acid contact, but they also bypass some of the saliva-mediated effects. The research on capsules, specifically, is thinner than the research on liquid. There are a few small studies suggesting capsules retain at least the gastric emptying effect, but the evidence base is much weaker. Form 4, drinking vinegars and switchel-style products. These are diluted vinegar drinks with added flavorings. Read the label. If the product contains 1 to 2 tablespoons of actual vinegar per serving, it's effectively the same as homemade dilution. If it contains less, it's flavored water with a vinegar suggestion. The brand decisions that actually matter come down to 3 things. The vinegar should be made from apples. Many cheap apple cider vinegars are diluted white vinegar with apple flavoring. The acidity level on the label should be 5 to 6%, which is the level used in studies. And you want the bottle to be glass, not plastic, because acid leaches plastic compounds over time. The with the mother question is mostly aesthetic. Both work. Filtered is fine. The most important practical advice in this section: drink it through a straw. Every single time. The straw bypasses your teeth, dramatically reducing the enamel erosion that is otherwise the most predictable long-term harm of regular vinegar use. Then rinse your mouth with plain water afterward, but don't brush your teeth for at least 30 minutes because the enamel is temporarily softened by the acid and brushing can scrape it. These small mechanical changes are the difference between a 20-year vinegar habit that supports your blood sugar and a 20-year vinegar habit that costs you $8,000 in dental work. This section is the one nobody else makes. The wellness internet treats apple cider vinegar as universally safe. For seniors specifically, that framing is incomplete. Risk 1: tooth enamel erosion. Tooth enamel doesn't regenerate. Once it's gone, it's gone. Senior teeth have already accumulated decades of wear, and many seniors have crowns, bridges, or veneers that are particularly vulnerable to acid. A 2014 case report in General Dentistry documented severe enamel erosion in a patient consuming 1 cup of apple cider vinegar daily. That's an extreme case, but the cumulative risk from 1 to 2 tablespoons daily over many years is real and largely preventable with the straw and rinse protocol I just described. Risk 2: esophageal irritation, particularly dangerous in seniors with hiatal hernia, GERD, or any history of acid reflux. The senior esophagus is more vulnerable to chemical irritation, and chronic acid exposure has been linked to a precancerous condition called Barrett's esophagus. If you have any history of reflux disease, apple cider vinegar, even diluted, is a bad idea. The risk-benefit ratio doesn't work for you. Risk 3: low potassium. There is a documented case in the Journal of General Internal Medicine of a 28-year-old woman who developed dangerously low potassium and brittle bones after consuming 8 ounces of apple cider vinegar daily for 6 years. That's a wildly excessive dose, far above what we're discussing. But it raises a senior-specific concern. Many seniors are already on diuretics, water pills, for blood pressure or heart failure. Diuretics deplete potassium. Adding daily vinegar to a baseline of medication-induced potassium loss is a meaningful additive risk. If you're on hydrochlorothiazide, furosemide, bumetanide, or any combination diuretic, and millions of seniors are, talk to your doctor before starting daily vinegar. Get a basic electrolyte panel. It's a $20 lab test that catches problems before they become problems. Risk 4: delayed gastric emptying in people who shouldn't have delayed gastric emptying. Remember mechanism 1: vinegar slows your stomach. For most people, that's beneficial for blood sugar control. For people with gastroparesis, a condition where the stomach already empties too slowly, common in long-standing diabetes, vinegar makes the problem worse. If you have diabetic gastroparesis or symptoms of it, including chronic nausea, early fullness, or unpredictable blood sugars after meals, apple cider vinegar may be making your situation harder, not easier. Risk 5: bone density. The same mechanism that depletes potassium at extreme doses can theoretically affect calcium balance over time. The evidence here is weaker, extrapolated mostly from animal studies and that one human case report. But for seniors with osteoporosis or osteopenia, this is one more reason to stay at the lower end of the studied dose range, not push higher. Risk 6, and this one is specifically a senior swallowing risk. There are documented cases of apple cider vinegar tablets, the capsules, getting lodged in the esophagus and causing chemical burns when they dissolve in place rather than passing through. This is more common in seniors with reduced swallowing function, dry mouth, or those who take pills lying down. If you use vinegar capsules, take them with a full glass of water, sitting upright, and remain upright for at least 30 minutes afterward. None of these risks individually are reasons to never use apple cider vinegar. Together, they're reasons to use it thoughtfully, at the studied dose, with the protective practices in the right person, and to stop the hand wave of, "It's natural, it can't hurt." If you're a senior on prescription medications, this section may be the most important 6 minutes of this entire video. Interaction 1: insulin and insulin secretagogues. Sulfonylureas like glipizide, glyburide, glympiride. These medications already lower blood sugar. Adding vinegar adds a second blood sugar lowering effect. The combined effect can produce hypoglycemia, low blood sugar, which in seniors can cause falls, confusion, and hospitalization. Senior hypoglycemia events are dangerous because they often happen at night and the person doesn't recognize the symptoms until they've fallen. If you're on insulin or a sulfonylurea, monitor your blood sugar more frequently for the first 2 weeks of vinegar use. Specifically, check your fasting glucose daily and a post-meal reading at least 3 times a week. If you see consistent readings under 90 mg DL or any reading under 70, that's the signal to either reduce your medication dose with your doctor's guidance or stop the vinegar. Interaction 2. Diuretics, as we discussed in the potassium section. The combination of any potassium-wasting diuretic and daily vinegar is the highest priority interaction in this video. If you take both, get an electrolyte panel within the first month. Interaction 3. Digoxin. Digoxin is a heart medication used in some seniors with heart failure or atrial fibrillation. It has a narrow therapeutic window, meaning the difference between an effective dose and a toxic dose is small. Low potassium dramatically increases digoxin toxicity risk. So the chain is vinegar plus diuretic equals lower potassium equals higher digoxin toxicity risk. If you take digoxin, this is a conversation to have with your cardiologist, not something to start on your own. Pattern interrupt new 13 at 50:30. Visual, 3 connected bottles showing the diuretic vinegar digoxin chain. Interaction 4, certain blood pressure medications. Vinegar appears to have a mild blood pressure lowering effect of its own, small but real. Combined with ACE inhibitors, ARBs, or beta blockers in a senior who's already running blood pressure on the lower end of the target range, you can get orthostatic hypotension where blood pressure drops too low when standing up. This is a leading cause of senior falls. Interaction 5. Medications metabolized in an acidic stomach environment. Some medications require a specific stomach pH for proper absorption. Chronic vinegar consumption alters that environment slightly. The clinically relevant examples are some thyroid medications, certain antifungals, and a handful of antibiotics. If you take levothyroxine for thyroid, take it well separated from any vinegar, at least 4 hours apart, to avoid absorption interference. Interaction 6. Laxatives and stool softeners. Some seniors using vinegar for blood sugar also experience changes in bowel function. Combined with osmotic laxatives, this can produce more dehydration than expected. Not dangerous in most cases, but worth noting if you're managing chronic constipation alongside diabetes. The simple rule again, if you take 3 or more prescription medications, talk to your pharmacist before adding daily apple cider vinegar. Pharmacists are excellent at interaction screening, and the consultation is free at any pharmacy. Take your full medication list with you. Here's the bottom line on the question we started with. Does apple cider vinegar lower blood sugar in seniors? Yes, modestly in people with already elevated blood sugar at 1 to 2 tablespoons daily when timed correctly, when consumed in the right form, when used alongside protective dental and esophageal practices, and when interactions with existing medications have been screened. That's a lot of conditions. That's also the truth. The wellness industry sells it as a one-size-fits-all metabolic miracle. The skeptics dismiss it as a placebo. Both are wrong. The evidence sits in the middle, and the middle requires you to know your own situation well enough to apply it correctly. I'll put the citations for all 19 studies referenced in this video in a free PDF in the description. Take it to your next doctor's appointment. Show your pharmacist. Make the decision together. That's how senior health is meant to work. Informed people working with informed clinicians, instead of either trusting wellness influencers or dismissing every natural option out of frustration.